Everyone, in our today's video we are going to continue with third unit, yoga and lifestyle, and we will discuss the last topic of this unit, lifestyle diseases. We have 5 lifestyle diseases in our syllabus and we are going to discuss all these today: obesity, diabetes, asthma, hypertension and back pain. Let's move on with today's class. The first is obesity. Obesity is defined as abnormal and excess fat accumulated in the body. If there is more than 20% accumulated fat in the body, can be considered as obesity. There is a way to calculate that is body mass index. Weight in kilogram, if we divide that with height in meter square, we will get our body mass index. And if that unit or that result is less than 18.5, the individual is underweight. If the results are between 18.5 to 25 or 24.9, the individual is recommended weight category. He is lying in that recommended weight category. And if the results are between 25 to 30 or 29.9, the individual is overweight. Beyond 25 till 30, overweight, and above 30 is the problem. We call them obese people. These are the individuals who are obese. They are suffering from obesity. These are certain causes for obesity, reasons. The first and the biggest reason is diet. If someone is eating more and burning less calories, the imbalance will raise the fat. The second reason is similar, physical activities. The biggest second reason, or we can say the two big reasons, one is diet, another is exercises. These two reasons are interrelated as well, and these two are very big reasons for obesity as well. If someone is not doing regular exercises, is going to gain weight. Third is genetics. It can be hereditary also. If parents are obese, the individual might get obesity. Third is poor diet. If individual is not having a proper diet with all the nutrients, vitamins, minerals, and individual is having fast food, junk food all the time, might get obese. And the next point is psychological factors. Mental stress, depression may also lead someone towards obesity, because in such situations individual used to or tend to eat more. There are certain asanas which are very helpful for obesity, and these are Vajrasana, Hastutanasana, Trikonasana and Ardhamatashendra asana. These asanas used to help to prevent obesity. Next is diabetes. Diabetes is commonly known as metabolic disorder. Our pancreas used to produce insulin, and insulin is a hormone which is required to dilute or to digest sugar in our body. Otherwise, if there is no insulin, the sugar level is going to raise, and this situation we call it diabetes. Either the insulin is not being produced in the body, or the human cells are not responding to the insulin properly. In both the cases, diabetes can be there. The individual, those who are suffering from diabetes, are very tired all the ways. They feel fatigue, they are facing cramps, they are dehydrated. These are general symptoms of this. They may face kidney problems, heart, lungs, internal organ related issues as well. There are two types of diabetes. First is type 1. Once known as juvenile diabetes, insulin dependent diabetes is a chronic condition in which pancreas is either not producing or producing very less quantity of insulin. Insulin, again, the hormone required to digest sugar in the body. So in this particular type, individual have to take artificial insulin. In type 2 diabetes, in this particular type, the diabetes blood sugar level raises because pancreas is producing insulin, but it is not, either it is not sufficient, or cells or the body is not responding properly. In type 2, insulin is produced in the body, but it is not as much required, it's less. Or second way is body is not responding properly. This is type 2. In this type 2, individual can control it by doing exercises and maintaining the diet. Artificial insulin might not be required in type 2 diabetes. These are the risk factors or the reasons for diabetes. First is family history. If parents are diabetic, there are very high chances that child will also be diabetic. Second is environmental factor. Environment also play a very big role in this. Third is weight. If individual is obese or overweight, he is at high risk. Then is inactivity, not doing exercises, not doing physical activities, living a sedentary lifestyle is also a risk factor for diabetes. It is repeated by mistake, family history. Then age is another factor. If someone is at older age, they are at high risk. The reason is again not only age, but elderly people are at higher risk. High blood pressure, if someone is already having high blood pressure, they are also at higher risk to have diabetes. Then abnormal cholesterol level or certain hormones imbalance might also lead to diabetes. The asanas which are helpful to prevent diabetes are Bhujangasana, Paschimottanasana, Pavanmuktasana and Ardhamatashendra asana. Next is asthma. Asthma is a condition in which your airways are narrow or swollen. Basically, it's a breathing problem, and this can make breathing very difficult, or sometimes it might get a chronic situation or a very serious situation for an individual. Asthma triggerings. These are certain situations which might trigger asthma attack, or that situation which is in that particular situation it's difficult for an individual to breathe. These can be the reasons for that. First is irritants or substances or some microbacteria in the air which can trigger the allergy. Second is airborne substances such as pollen, dust, particles in the air. Such things can also trigger the asthmatic situation. Third one is respiratory infections. If individual is suffering from some cold or some flu-like infection, that might also lead to problem in breathing. Next is cold air. If anybody suffering from asthma is going in very cold environment, and breathing in cold air might trigger asthma, a breathing problem. Then is air pollution and irritants such as smoke is very big reason for this. Then certain medications also, beta blockers and certain medicines are not good, or they are not safe for patients with asthma. They must take care of such chemicals and salts. And then strong emotional stress, psychological reason. This is a psychological reason which can trigger asthma. And the asanas which can prevent asthma are Sukhasana, Chakrasana, Gomukhasana, Parvatasana, Bhujangasana, Paschimottanasana and Matsya asana. The next lifestyle disease is hypertension. We also call it blood pressure, high blood pressure. High blood pressure is a common condition in which the long-term force of the blood against the arteries or the walls is high enough than normal. It's higher than normal, is known as high blood pressure. The blood pressure is basically a reading. It is kind of, we can categorize it in two types, systolic and diastolic. We used to measure it in millimeters of mercury. mmHg is the unit in which we measure blood pressure. We have two numbers. First is upper number of measurement, the pressure in your arteries. Please listen carefully. Pressure in your arteries when the heartbeat is systolic, and the second is the lower number of pressure when the arteries between the beats is diastolic. And these two numbers are also known as upper and lower BP in general terminologies. The normal BP is 80 is lower and 120 is upper in general conditions. It is categorized in two ways: primary, essential hypertension, and secondary hypertension. For most adults, there is no identifiable cause of high blood pressure. This type of high blood pressure is called primary essential hypertension, tends to develop generally over many years. Young kids, small kids they don't have any such situation where they are having any pressure. So with time, when we are growing, we are gaining this primary hypertension. Secondary hypertension, some people have high blood pressure caused by any kind of situation which is boosting or shooting up the BP all of a sudden. This type of high blood pressure, called secondary high blood pressure, tends to appear suddenly. It causes high blood pressure rapidly. It is not like primary hypertension. It immediately boosts the pressure, which is dangerous, very dangerous for an individual. Various conditions and medications can lead to secondary hypertension, and individuals suffering from such hypertension must take medicine. The risk factors of hypertension are: the first is age. With age, hypertension used to increase or blood pressure used to increase. Second is family history. If parents are suffering from blood pressure or hypertension, individual he's at high risk. Then next is being overweight or obese. Obesity is reason for many problems, and hypertension and blood pressure is one of them. Not being physically active, physical exercises are going to prevent us from many diseases, and if we don't do that, we are at risk of hypertension or blood pressure as well. Using tobacco may also lead to blood pressure or hypertension. Too much salt intake in diet, more than normal or more than required salt intake, is a big reason for hypertension or blood pressure. Next is stress. Psychological or mental stress is another reason for increased blood pressure in humans. Next is certain chronic conditions. If someone is in some chronic condition, that situation might lead to high blood pressure. And improper diet is another big reason. If someone is eating deep fried food, lots of fried food and junk food, they might also have high blood pressure. They're also at very high risk of hypertension. The asanas which might help in preventing hypertension are Tadasana, Vajrasana, Pavan Muktasana, Ardha Chakrasana, Bhujangasana, and Shavasana. The last is back pain. Human spine is a column of bones. We call them vertebras. There are multiple bones held together by muscles, tendons, and ligaments and synovial fluid. Those synovial fluids or discs are to absorb the shock. A problem in any part of spine may cause back pain. What are the risk factors of back pain? What can be the reasons? Another reasons for back pain are age. Elderly people, if they don't maintain their fitness level, they may lead to back pain. Second is lack of exercise. If we don't keep our back muscles strengthened, muscle strengthening and muscle tone well, we may lead to back pain. Then excess weight. Overweight of body might stress your vertebra, synovial fluid and the vertebral columns. Next is any disease. Any infection or disease may also lead to back pain. Then improper lifting. If body posture is not maintained well while lifting some weight, that may lead to back injury or back pain. And the psychological conditions, if someone is stressed and sitting in wrong posture, may also lead to back pain. Smoking in a certain situation may also lead to weak muscles, and that may lead to back pain. And the most important is a healthy diet and proper exercise. If we don't do that, it may lead to back pain. The asanas which are helpful to prevent back pain are Tadasana, Ardha Matsyendrasana asana, Vakrasana, Shalabhasana, and Bhujangasana. With this, we have completed our third unit.